Next, let us see the 10 commandments of cervical cancer. Cervical cancer was one of the commonest cancer all over the world in women. Now slowly it is getting decreased, and now it is not the commonest cancer. A good news that is there. How is it happened? That is because we have eliminated the reasons for cervical cancer. What was the most common reason for cervical cancer? It is the poor genital hygiene. It is a poor genital hygiene because those days the people, there was no institutional deliveries. Deliveries used to be conducted in homes by dais. There is no aseptic procedures, precautions taken like that. Now all deliveries are institutionalized. Nobody can conduct a delivery in home or something like that, because the government has made it a mandatory, and getting a pygmy number for getting the birth certificate is a must. So all deliveries are institutionalized, number one. Number two, all delivery patients undergoing deliveries in the government hospitals have been given incentive that attracts more and more patients to the hospitals to take deliveries. Another most important factor why the cervical cancer is decreased today, because of the availability of vaccine. The next important cause for the cervical cancer is the viral infection. So now we have got the vaccines. It is one of the cancers which can be prevented by a vaccination. So only two cancers now today can be prevented by vaccination. One is a liver cancer by hepatitis B vaccination, and it's a cervical cancer vaccination. So all of us must know cancer service can be prevented by vaccination. When to give, how to give. It is always better to give the first vaccination before first sexual intercourse. So we advise them to get it done after the people attain menarche, and at least before marriage. That is what we advise. It is a 2 doses vaccine given at the interval of 15 to 20 days. Now we have got the quadrivalent vaccine which takes care of all the strains of HPV virus. So it is a request to all the community people to get their female children vaccinated before their marriage to avoid the cervical cancer. We are fighting with the government also to make it mandatory. The cancer service vaccination must for the marriage certificate. That is what we are trying, that is there. So the cancer cervix, though it was a commonest disease, has very much come down because of the improvement in the genital hygiene, vaccination, etc. Okay, unfortunately somebody has developed cancer cervix. Is it possible to cure? Yes, it is a highly curable disease. The surgery and radiotherapy are the main components of the cancer cervical treatment. The chemotherapy has got a very little role. The surgery, now we need not do open surgery. We got the minimal access surgery where we do with very minimal holes without a scar, painless. The patients can go home on the second day or third day of the surgery. The minimal access surgery has come in a very big way in cancer cervical management. And we got the ultra-modern radiotherapy techniques, both tele and brachy. And we got IMRT, IGRT, even some patients, obese patients, high-risk surgical patients, little bit advanced disease, more than stage 2, can be easily cured by radiotherapy alone, with combined chemotherapy to a little extent. So a cancer cervix is a curable disease. It is a disease which can be prevented by a proper vaccination, and it is a disease which can be prevented by proper genital hygiene. Keep your genital parts clean and neat. Even if you develop, you need not worry. We have got very good surgical and radiotherapy techniques for its cure. Thank you.